Hey guys, welcome to another video. So, in this one, I'd like to talk about should you get sinus surgery? And this is based on my experience. So, with CF, we have sinus issues. Most of the CF population does. I don't know if you guys have heard, but that goes to saying, well, once you get the first sinus surgery, it just gets worse from there. That's what I was told, at least. And that was true in a sense. I can't remember that far back, but it was about 5 or 6 years ago when I was getting a lot of sinus pain, having a lot of lung infections, and so my sinus doctor, my ENT, suggested I have my first surgery. And this is the surgery that they were to go in and just open everything up, right? Make everything wider, all the sinus canals wider. They just kind of just open up, basically, let them flow better. Because the problem is, since we have CF, we have that thick, sticky mucus. Well, we get it up in our sinuses, and it's not able to flow through our sinuses correctly. Therefore, it gets stuck. It starts to grow bacteria, and then we get sinus infection, and then our sinuses drain into our lungs at night, and therefore, when we're sleeping, the infection spreads. So it's really important to keep your sinuses clean, and I can't remember exactly, but at that point, I'm pretty sure I didn't really have an option. I had a lot of sinus pain, and things weren't really getting better. And now, 5 years later, knowing that and looking back on everything I've been through since then, it's kind of one of those things what could I have done differently, at least? So I had my first sinus surgery, and after I had that surgery, before I had the surgery, I should say, I was going to the hospital as a patient for 2-week stays, probably every month, maybe every 2 months at that time. It might not have been that bad, but every 2 or 3 months at least. And after I had that surgery, I did not have one hospitalization. I'm not even sure if I had oral antibiotics for 6 months. And that was a big stretch. I remember I was dating a girl at the time, and she didn't even know I had CF because I was never sick during that 6 months. And so, usually if you see my story in college, I was pretty sick all the time. Anyway, so after that surgery, that caused me to need multiple cleanouts. And cleanouts, what they say, is where they go in, they put you to sleep, and then they just kind of rinse everything out. It's still painful, you wake up and everything's been washed out in there and everything like that. So it's still a little painful, but it's not near as bad as actual big surgery, right? So I had 5 cleanouts. I should say 4 cleanouts since then. And then I moved to Florida Clinic, ENT down. And he was really good. He's really knowledgeable, intelligent, and has been doing this a long time. And he really knows his stuff when he's explaining things. But he wanted to do a surgery called the old way. I think it was called obliteration. It's really gross what they do, so I'm not going to explain it the old way. But nowadays what he does is he goes in there and he drills off some of your bone. And with me, I don't have any sinus issues down here. I only have them up above my eyebrows. So what he did was he went in here and drilled this bone, this frontal bone. Wait, where's my face? But drilled this frontal bone so it's more of a curve instead of a kind of like a sharp point. Because when it was sharp like that, the mucus and junk couldn't get over that. And so I was getting a lot of pain right in here, stuff stuck up there. So he drilled that to make it more rounder, and it didn't change my appearance or anything. I didn't have some different face back then. But that was just 6 months, 7, 8 months ago. And he drilled that out, he cleaned everything out. And the problem was he didn't use stents afterwards because he thought, everything looked good. Well, once I got out of surgery, I was on, that's another thing about sinus surgery, by the way. Afterwards, you're usually on painkillers. And painkillers are great when you have pain, but the problem is they lower your respiratory rate. So if you do work out, or I work out, so I don't know what it's like if you didn't, but either way, they lower your respiratory rate to where you're going to be knocked down a bit. You're on antibiotics after surgery because all that stuff just got stirred up, so they try to keep that suppressed with antibiotics. But you're still on painkillers, and so your respiratory rate gets cut down. So, like with me, I noticed even when I got off the painkillers, it was at least a few weeks to get myself built back up to the rate I was used to working out at and moving along throughout the day. So that sucks. That's one thing about surgery that sucks is, one, it's surgery, but two, you do get knocked down a bit. But I was able to work out, a week or 2 weeks after each surgery, and everything was fine. But anyway, so he drilled out those, and it flows better. But what did happen was I built up a lot of scar tissue. He said I was just a strong healer, my body is. So therefore, from all that stuff in there, I built up all this scar tissue right in here. And then, once I had that junk up in there, it would get stuck on the scar tissue and whatnot. And I was having a lot of sinus pain after that surgery. So my last surgery, which was in March of this year, so about 3 months ago, was just mainly to remove the scar tissue. And he went up there, he cut out all the scar tissue. He said he did do a little bit more drilling to make it more rounded. And then he did find some infection up there, got that out. And after that, he put a stent in there for a month. And the stents you don't feel. After surgery, I kind of felt a little bit of pressure, but that went away. I guess I just got used to it, but that went away. And so once he pulled them out, it was so weird. I mean, you picture this huge, it was almost looked like chicken wire, but it's like this little foil type stuff, and just pulled it out of my nostril. It was like patches like that big. Anyway, it was weird to see. But since then, I've not had any problems with my sinuses. I've had a couple of headaches here and there, but not nearly like I was. I used to get them literally every single day, and I was just used to it. I mean, I had sinus pain, and I was like, okay, I could deal with it. And some days, I couldn't do anything. I mean, it made me tired. I would just have to lay down. It was like I couldn't do anything. Here's actually some pictures of how bad it hurt. I was just laying there with towels and cold wraps around my head and stuff. But yeah, I don't know. I think I didn't have a choice as far as surgery goes. I had to get surgery, that first surgery I'm talking about. And then, I'm glad I'm where I'm at now, but I do, hate that, I had to go through all 7 surgeries now. So, if you have sinus pain and you think, you could be adamant about washing them out and trying to get your infection cleared out another way, or you think it might pass, then try your hardest to do that. But don't just go get surgery because you have CF, you're used to doing operations and you've been in the hospital a lot, and you're like, if it's going to fix it, just do it. That's how I was. I was tired. I was in college. I was tired of getting sick. I was tired of, being in pain sinus-wise. And I said, okay, if it will fix it, just fix it. And I think I didn't have any other option. But it was so long ago, I'm not really sure. I wish I could think back of my mindset back then and see if I ever second-guessed myself. But yeah, so if you are looking at maybe surgery, or if you have CF and you're looking at maybe having your sinuses surgery done, try not to do it if you don't have to. It's not a huge deal, but it can become a huge deal. Even after I had that first surgery, I've still been in pain for 4 or 5 years, often. About every 3 to 6 months, I had to have that operation where they put me to sleep and clean it out. And then, you're on a little bit of painkillers after that, so knocks you down a little bit. So, yeah, the key point is don't do it unless you have to. Really think it out before you have these sinus surgeries. Like I said, now I'm fine. Everything's been going well, but that doesn't mean it's going to be going well forever. I don't know what the future holds. So anyway, guys, I just want to give you an insight on how my surgeries were, what I had done, and my thoughts on whether you guys should get surgery or if it truly fixes it or not. But hope you guys enjoyed the video. Thanks for watching. Subscribe down below. Like the video if you liked it. But let me know in the comments if you guys want to see other topics that I can cover. And I will try to do that as soon as I can. Thanks, guys. Have a good night. Bye.